case of community transmission. But I don't want everyone to be alarmed at present. We've got some detailed contact tracing happening, and you'll hear very shortly from Dr. Bennett, who will give you more details about where this doctor has been in the community. The doctor has spent limited time in the community, so that's also another positive for us. We have had 5,657 tests in the past 24 hours, and our vaccination rates at the moment, we're up to 18,411, but our Health Minister, Yvette Darke, will give us an update about vaccinations. So last night we were advised of this new case. It is a doctor who assessed 2 COVID positive patients on Wednesday. Now, as everyone knows, we are seeing more people testing positive in hotel quarantine coming in from overseas, which of course we know that our hotel quarantine is that last line of defence. But then we move the positive cases into the hospital. So we know that this doctor who assessed these 2 COVID positive patients was at the hospital at the time. Now, she developed symptoms on Thursday and returned a positive test late yesterday. Now, the patients she was treating have the UK strain, but we do not yet know if the doctor has that same strain, but we are expecting that to be the case. So contact tracing is underway. Dr. Bennett will talk in more detail and give the public some details about that. But now what we're asking everyone to do is that all hospitals, aged care and disability services in the Greater Brisbane will be closed to visitors, and anyone going inside would have to wear a mask in those places. So this includes Brisbane, Ipswich, Logan, Moreton Bay and Redlands. And of course this is precautionary measures that we are taking now, especially over the next 72 hours. So there is no need for the public in general to be wearing masks. We will be assessing this each day, especially over the next 72 hours, to see if we have any further community spread. But Dr. Bennett will explain that this has been very quick from the contact to the diagnosis, and unlike when we had the cleaner out in the public for, I think it was for 5 days, this doctor has not been out in the community for a long period of time. It's been very short and very limited in her contacts. So we'll be talking about that a little bit further. So look, I'll hand over to Dr. Bennett and then our Health Minister, and then we're happy to take some questions. Dr. Bennett.
Thank you, Premier. Good morning, everyone. So just to reiterate, we have a doctor at the PA hospital who has tested positive to COVID-19. That particular doctor was managing 2 patients that we know were confirmed to have COVID, and that was in the early hours of Wednesday morning. She did a subsequent shift at the PA hospital later that day into Thursday evening, and then late Thursday developed some very mild symptoms, and on waking Friday morning had a sore throat and did exactly the right thing and went and got tested immediately Friday morning, and the result was returned late Friday. So as you can see, a very quick chain of events, and we really want to thank that doctor for coming forward quickly and getting tested. Having said that, we do have a little bit of work to do with respect to contact tracing. So whilst she wasn't symptomatic when she was working at the hospital, we still, as you know, take a period before the onset of symptoms as being potentially infectious, and so there will be a big exercise in contact tracing underway at the moment as we speak at the PA hospital, identifying all residents, or all patients I should say, and all staff who may have been in contact with the doctor during that time, and they will be managed appropriately depending on what contact they had, with some staff going into quarantine or patients and some being tested. So there's a lot of work to do over the next 24 hours. With respect to the community, the person was infectious in the community on Thursday afternoon and evening, and we will publish those sites shortly, but just so you are aware now, there are 3 high-risk sites. One is the Morning After Cafe at West End, where the person was there present from 2 p.m. to 3:15. Now the good news is, as the Premier said, there's only been a short period of time infectious in community, and apparently the person was sitting outside as well, so following all the COVID safe rules, so we can all be assured about that, and we should be fairly easily be able to identify through the contact tracing app who was also there at that time, and Public Health will be in contact with those people, and they'll be going into quarantine as well. The other sites are the corporate box gym at Greenslopes, where the person attended between 5:45 and 7 p.m. And again, anyone there at the same time, and we understand there are in the vicinity of about 11 people will go into quarantine. And Stones Corner Hotel at Stones Corner that evening between 7 and 7:45 p.m. Now, all those venues are being very cooperative with public health, and again, a large amount of contact tracing going on as we speak, and we'll know more about the number of contacts in the next 24 to 48 hours. There are a couple of low-risk venues, and one is McDonald's at Cooperoo between 3:10 and 3:20, where the case did drive through, so that's what we would call low risk, and anyone there around that time will just be asked to monitor symptoms and get tested. But also the gym after 7 p.m. when the case left. We know that gyms are high risk and that transmission has occurred in gyms. So anybody who was there after 7 p.m, even though the person had left the gym, will be asked to monitor that for symptoms closely and get tested. So I think the community can be reassured that there's a lot of work going on, and because this has happened so quickly and we've really, the doctor presented and was tested quickly, and we've got the information about where she's been, anyone who is potentially exposed will be going into quarantine and managed, and we hope to prevent any further transmission in the community. Having said that, we all still need to remember that COVID is still with us, and so we have had an infectious case in community, and we just have to remind the public, anyone with any symptoms, no matter how mild, please go along and get tested. That really supports the efforts of the health staff and the public health staff and everybody else across government in helping to contain any community transmission. And just remember those things about using the COVID Safe app, checking in when you go into venues, physical distancing, hand washing, and all those sensible things that we know the community has been doing for some time. So thank you. I'll hand over to the minister.
So we are taking measures, as we announced last night, in relation to the PA hospital as well, so restricting non-essential visitors, also looking at any release of patients, first identifying whether they have been in contact with this doctor, and we are looking at any redirection through the Queensland Ambulance Service. That's worked very well overnight. We are still taking walk-in to the emergency department, but we are saying that if you can go to your GP or another emergency department, we ask you to do that. But of course, each incident is being assessed as to suitability to be treated at the PA or whether they should be referred elsewhere. We will closely monitor our testing clinics so that if there is any surges, we are standing up and we are ready to stand up extra capacity if needed. We do have a testing clinic at the PA hospital, but I've asked Health to have a look at whether we should have another one in the surrounding area as well, so that people who are coming forward to get tested will be waiting the least amount of time as possible, but everyone should expect, as we had before, that there may be some long lines, and be prepared for that if you're coming forward and getting tested. In relation to the vaccination, this is what we've been saying from day one. The vaccination rollout is going to occur over some months. We are only in week 3 of the national vaccination rollout. So the risks of the spread of COVID is still very much real, and we need to continue all of our practices around social distancing, hand hygiene, and of course, if you are unwell, staying home and getting tested if you have any symptoms, no matter how mild. The great news in relation to our vaccinations is that our Phase 1A group, which is our frontline workers who are working directly with COVID patients or potentially people at risk of having COVID, we have already vaccinated 50% of those. So that cohort is 37,000 people. We've already vaccinated 18,411 of that group. So half of them are already done. And next week, we will start with the second vaccination of that group. So that means from next week, thousands of people will become fully vaccinated for the first time in Queensland against COVID-19. We are on track to delivering our Phase 1 within the first 6 weeks of everyone getting their first vaccination, remembering we have to wait 21 days before that second. In the meantime, we will commence our 1B near the end of the month, so we do not need to wait till we complete 1A to move into 1B. We've already started some of our 1B cohort in that this week we have started vaccinating and having a team out vaccinating in the Torres Strait. We have chosen to bring the Torres Strait Islands forward because we are seeing large numbers of positive cases in PNG, and with our close borders we are very concerned of possible transmission, so we believe it's important. 1B, we're going from 37,000 people in 1A to 1 million Queenslanders in 1B. So a much bigger group. We will be moving on to vaccinating by the end of the month. So we will see a rapid escalation of our vaccinations, and we have seen us go from one site just 3 weeks ago to we now have 17 vaccination hubs operating in Queensland. So this is great news, but of course it's still contingent on getting the vaccine on a regular basis and in the numbers that we need to continue to roll that out, because we need to keep adequate supply just in case we don't get future supplies when they're due, and also to make sure we've got enough for that second vaccination, because we can't afford to start and stop on a continual basis. So we do ask that everyone have a look at the websites, those sites, after Morning After Cafe at West End, Corporate Box Gym at Greenslopes and Stones Corner Hotel Stones Corner. These are high-risk venues. We ask people to have a look at the website to see if they've been at those sites on the 11th of March with the times that are listed, and of course the low-risk venues of McDonald's at Coorparoo, and again Corporate Box Gym at Greenslopes if you were there after that time to monitor for symptoms. We will continue to update the Queensland community as we progress over the next 3 days, but we do ask people to remember visiting aged care facilities, youth detention centres, correctional services sites, disability services and hospitals will be limited in the Greater Brisbane area for non-essential visitors, and masks will be mandatory in those facilities over the next 3 days.
Premier, can we ask, has this doctor received the first vaccination?
My understanding is that no, she hasn't. But at the PA, there have already been 1,615 staff that have received their first vaccine. But as we know, we are getting a lot of people that are testing positive coming in from high-risk countries at the moment, and I think we've seen something like 40 in the last fortnight. So it is high risk, and once again, this is once again, why I keep talking about regional quarantine out of the cities as a possible solution to this. But what we do know is that the contact tracing is underway very quickly, a very rapid response to this situation, and we'll be keeping the public updated over the next 72 hours. So the next 72 hours is pretty critical to see if there has been any further community spread.
Is there a particular reason why this doctor wasn't one of the first vaccinated at the PA?
I might get health to comment on that, but as the Health Minister said, it's a gradual rollout. We've already done 1,615. Not everyone working in contacts with hotel quarantine people have been done to date. So, it's a slow and steady process to get this right. And of course, as the Health Minister said, as we get more and more supply, more and more people are going to get vaccinated.
Is this the first doctor in Queensland?
I'm unsure about that. No, it's not. But I might get Dr. Bennett just to answer any particular questions about that, and then the Health Minister. Okay.
Yeah. I'll just cover up on the first doctor in Queensland. We have had a number of health staff test positive. Certainly early on in the pandemic, that was related to either community or travel-related infection rather than hospital-acquired infection. But there have been a very small number. I don't have that figure to hand, but that have tested positive, as we would have previously reported. With respect to this particular doctor, as the Minister's outlined, the vaccination program is underway. It's on track. It's always been anticipated to take some time in both 1A, but just to the completion of vaccination. So it's a process, and there's light at the end of the tunnel, but there's certainly a long way to go. And as the Minister also outlined, we don't have anyone fully vaccinated yet. So until we are confident that both individuals have immunity and that the population in general has a level of coverage, we will continue to respond to cases to suppress any transmission in the community, and that's what we're doing now.
On that point,
Is there a failure of PPE in this case for a doctor who is treating COVID patients to get COVID?
So this doctor wore appropriate PPE during the time she was with the patients. There were no reported breaches in use of that PPE, but what we know about this virus is that it is highly infectious, and I think both the rapidity at which the doctor became infectious and the fact there were no identified breaches shows that, and we've seen that here in Australia before, and we've seen it around the world. And certainly the hospital will look into that and try and identify any particular cause that may need an improvement, but there's nothing to suggest that that has occurred. It is a virus, it is highly infectious, and that's what's happened. So the most important thing that we can do right now is just focus on preventing any further transmission.
How long will it be before we know what variant is?
Hopefully by tomorrow we should have a result on that. That's my information anyway, so we're all very keen to understand that.
so there are several doctors right now in Queensland working in COVID wards who haven't had their first vaccination.
As the Minister outlined, no, the 1A, which is exactly that part of the program where all doctors who are actively caring for COVID patients will get vaccinated, is not yet complete, but we're on track to do that, and there's certainly been a large proportion already that have been vaccinated with their first dose.
And I guess again with this particular doctor, is there a reason why she wasn't one of the first? Is there a priority list? She maybe doesn't have contact with COVID patients as much, or is it just simply first in, best dressed? What's the process there?
I might ask the Minister to talk about the program.
Thank you. So there's a couple of things here. As I understand, initially when these two individuals came in, they were showing symptoms, but they hadn't been identified as positive yet. But we need to remind ourselves we are only in week 3 of a national vaccination rollout. There are millions and millions of Queenslanders and Australians still to be vaccinated. We have 37,000 people in the first group. They are our frontline health workers who work directly with COVID patients. They are our hotel quarantine staff who are in direct contact with people who are arriving from overseas that are at risk of being positive. We have our paramedics who transport them. We have our border control staff who meet these people if they come off the planes. And of course we have our QPS officers as well, and the environmental officers that go in and do the cleaning and the deep clean. So all of these 37,000 people are equally important to each other. Every one of them need the vaccine as soon as we possibly can give it to them, and that's why that we have prioritised them. And our plan is, over the first 6 weeks of the rollout, that this is the group that will get the vaccine. We have already achieved that, half of that already in 3 weeks, remembering we only started with 1 site and 3 sites that first week, and we are now up to 17 hubs. So we have seen on a daily basis significant increase in our vaccinations. We have 2 sites that are now open on Saturdays, the RBWH and the Cairns Hospital as well. With relation to PA directly, 3,862 hospital staff are in that 1A group. 1,615 have already been vaccinated. So half of the 1A group that work at the PA hospital have already got their vaccine in the first 3 weeks, and some of them will start getting their second vaccination from this week because they were in that first week as far as vaccination hubs. So we are on track. We are delivering exactly what we said we would, in line with the national agreement and in line with our own targets that we set ourselves to roll out the vaccination for the first injection to our frontline workers in the 1A group.
Minister, are
In
those...
the aged care facilities that are locked down for 3 days, is there any chance, any likelihood, what's the likelihood that that may spread should there be any other cases?
Well, that's a lot of hypotheticals at the moment. You know, we all know what the risk of spread is. We've seen it globally. We've seen it interstate, and we dealt with it in our first wave here in Queensland. But what we've also shown is Queenslanders do respond when we call on them to do so. We know we have world-leading contact tracers. We know we have the best measures in place to contain COVID-19, and we have managed to contain this very well. We have 42 active cases right now in Queensland, and we are managing these cases. So we have one positive case in the community right now, one. That case, that individual was only in the community for approximately 1 day. That person identified became infectious within 36 hours. It's a very tight window. That works in our favour. That means that this person was not in the community for days on end, visiting multiple sites. All of this works in our favour, but we have to let the contact tracers do their work, identify how many close contacts there are, asking people to quarantine and getting that testing done. So at this stage, we are proposing nothing more than what we have announced today in relation to the restrictions on the PA hospital and the restrictions on aged care hospitals, disability facilities, and of course correctional and youth detention centres in Greater Brisbane.
In relation to changing the vaccination program to emphasise the doctors, people working with COVID positive people earlier?
So the 1B group includes the rest of the health workforce, all of the rest of the health force. Now that we have received the AstraZeneca, and once we get confirmation from the Commonwealth about the volume of AstraZeneca that we will receive going forward, then we can start moving on that 1B. Now, the Commonwealth has already said we're starting 1B at the end of this month. We are absolutely ready for that. And we've already brought some of that forward, as in the remote communities in the Torres Strait. So if we get it earlier, we will look at delivering it earlier, but we must make sure we prioritise this 1A group first for all the reasons we're talking about today. But the rest of the health workforce will be 1B. So the rest of the health workforce will start getting the AstraZeneca by the end of the month.
I meant within the 1A group, sorry, within the 1A group, is there any...
Oh, look, we will continue to look at the health workers who are in contact with hotel quarantine guests coming into the hospital, and if that group needs to be re-evaluated and broadened, we can look at doing that. But remembering, within 3 weeks, we will be vaccinating the rest of the health workforce anyway. We will start vaccinating the rest of all of the health workers in Queensland within the next 3 weeks. So we are progressing that quite quickly.
Minister, we've only had...
to have this doctor sort of in contact with someone who had COVID on Wednesday and then showing symptoms by the next evening?
Well, as Dr Bennett said, this is it's very rapid. It was about a 36-hour window. I believe we saw similar results with the cleaner, with the UK variant, with the Grand Chancellor case. So we know that this is a highly contagious virus, and we know the UK variant is even more contagious. So it's concerning but not surprising at all. But the good news about this is because the symptoms came on so quickly and that the doctor came forward and got tested and quarantined herself until she got her results, it means the risk to the community is far lower.
Does that mean, though, that there should be some mandatory testing in place for health workers rather than waiting for symptoms to show up?
Well, as I say, we're rolling out this process. There's a reason why we do the testing that we do, and I might ask Dr Bennett to talk further on that. But as Dr Young has said, there's not necessarily a benefit of testing the health workers who might not be working in those COVID wards every single day to test them when they're asymptomatic on a daily basis. What is most important is we are testing the hotel quarantine staff who are directly in those hotels on a daily basis to make sure that they're not transmitting it out into the community. But we are rolling this out as quickly as we can to these frontline health workers.
Did this doctor work in any other parts of the PA hospital, or was she mainly in the COVID section?
My understanding is she did work around the hospital. That's why that contact tracing is going on right now.
And she had an extra shift, she said, on the Thursday, is that right?
Yes, so I asked Dr. Bennett to confirm, but I believe she worked through till Thursday afternoon. So I'm happy to Dr. Bennett to confirm that.
And just what areas did she work in and how many patients did she come into contact with?
So the doctor in question, so she had a shift. Remember, she came into contact with the cases very early Wednesday morning, and she had another shift Wednesday afternoon that went into Thursday morning. So at the hospital, and that was before she was symptomatic. Now, she understands she has worked in various areas around the hospital. I don't have the numbers. That's exactly the work that's going on now about how many people she was in contact with. But the nature of the job was that she did work in various areas of the hospital.
We should ask how is she?
Yeah.
She's very well at the moment. Thank you for asking, but she is very well. And she's concerned, like the rest of us, clearly. But as I said, she's come forward very quickly. She was tested within 2 days of having seen the case, and we can't ask for more than that. So.
Can I just actually ask a little bit about PMG cases? Just in regards to, are you concerned about the PMG cases? I mean, Michael Samare's funeral was yesterday. There were thousands of people there, not many masks at all. We're getting those cases coming from PMG now. Is the rollout of the Torres Strait going to be fast enough?
It's already underway. Yeah, I'll answer that. It's already underway. We prioritised the vaccination up in the Torres Strait. I talked about that in Parliament as well. And I also advised National Cabinet that we were doing that as well. So we're keeping a really close eye on Papua New Guinea, very close to Queensland, and of course our vulnerable communities.
Are you concerned that there was that big funeral and there weren't any masks and the situation that it is?
Well, I think it's concerning the situation in Papua New Guinea, full stop. So once again, you know, is a world pandemic, and we've got a lot of neighbours close to our borders as well. And, you know, we've got to make sure that the vaccine goes out to those communities.
The patients who are, the PMG patients who are in Cairns at the moment, what variant do they have? What strain?
I'm unsure. We can find it out for you. Okay. Thanks, everyone. Thank you. Thank you.